Welcome to the High Cholesterol module for trainers. We've designed this as a companion to your trainer's guide to help you visualize the recommended steps for sharing information about high cholesterol effectively. As a trainer, your goal is that by the end of the session, participants will be able to define high cholesterol, high-density lipoprotein cholesterol, or HDL, low-density lipoprotein cholesterol, or LDL, and triglycerides. List the causes of high cholesterol, identify health problems caused by high cholesterol, explain recommended cholesterol levels, name the types of medications used to treat high cholesterol, list ways to control high cholesterol, and prepare an action plan. Here's a quick overview of the flow of a complete high cholesterol session. The introduction should take around 10 minutes. The first group activity should take around 15 minutes. A discussion about controlling high cholesterol should take around 10 minutes. A second group activity with more about cholesterol should take around 15 minutes. Another group activity titled The Problem Solvers should take around 30 minutes. Allow 5 minutes for discussing the action plan, and closing the session should also take around 5 minutes. You may decide to omit this item if you're conducting a 60-minute version of the session. Now that you've seen the big picture, let's talk about the materials you'll want on hand before your participants arrive. Here's a checklist of materials that'll help the session go smoothly. Check that you have a flip chart, markers, pencils or pens, name cards, and optionally refreshments. There are 3 handouts for this session: a handout titled Cholesterol Health Card, an action plan to lower or prevent high cholesterol, and a handout titled High Cholesterol, What You Need to Know. Print out enough copies for all of your participants before the session begins. There are also 2 sets of cards. There are 4 activity cards and 3 scenario cards. You'll only need 1 copy of each card since you'll be dividing the participants into teams, and each team will get 1 card. If you are conducting a 60-minute session, you won't be needing copies of the 3 scenario cards. You'll find all originals in the printable materials section of your trainer's guide. Lastly, prepare an attendance sheet so your participants can sign in when they arrive. With your materials in order, you can begin introducing the session. Topic A of the Trainer's Guide covers everything you'll need for getting the session started. As the participants enter the room, greet them warmly to create a welcoming atmosphere. Ask each person to sign the attendance sheet. Write each participant's name on a name card and make sure the card can be seen. After all participants are seated, introduce yourself formally to the group. Ask participants to introduce themselves and provide a simple guideline about what information they should share. For example, you might ask that they state their name, their hometown, and a favorite hobby. After the introductions, explain that the session will last 60 minutes or 90 minutes, depending on the time you've allowed, and tell the participants what they can expect. You can state that there'll be group discussions about high cholesterol, a variety of activities for learning about high cholesterol in a fun way, and opportunities to think about and share ideas about high cholesterol. Make a special point to encourage participants to ask questions at any time during the session. Remember to mention where the restrooms and water fountains are, especially if there are participants who are unfamiliar with the location. Before you begin the actual content of the session, Ask the participants for suggestions about setting some ground rules for the next hour or 90 minutes, and write their suggestions on the flip chart. Keep the rules visible someplace in the room throughout the session. Your group is likely to come up with their own ideas, but typically it's good to include turning off cell phones, keeping all discussions during the session confidential, feeling free to ask questions, and avoiding sidebars by directing all questions to you or to the entire group so that everyone can hear the discussion. The first group activity is item B in the trainer's guide, and its purpose is to help participants understand what high cholesterol is and what the different types of cholesterol are. You'll be using your markers, the flip chart, and one copy of each of the 4 activity cards, each containing different information about cholesterol. You'll find sample instructions for introducing this activity in the trainer's guide. You'll use your own words, but you can begin with something like, "Now, to start talking about cholesterol, we're going to conduct an activity. It'll be fun and easy, so please try to relax while I explain what we'll be doing." After you've introduced the activity, divide the group into 4 teams and give each team one of the activity cards. Explain that their task is to take 5 minutes to read the information on their card, discuss it with their team, then answer the question at the bottom of the card. Let them know that they'll be asked to select one team member to report back to the group to explain the information on their card. Reassure participants that they shouldn't worry about memorizing all of the information on the card, and that the purpose is for them to understand the information. Also let them know that if they have any trouble reading the information, they should ask for help without feeling embarrassed. For example, someone may have forgotten to bring reading glasses. Give the teams 5 minutes to read and discuss the information. During the team discussions, walk around the room and offer your help. You'll want to convey a friendly and positive attitude. Make sure not to criticize the participants or make any negative remarks. Let the teams know when there are about 2 minutes left so they can start finishing up. When the 5 minutes are over, ask the selected member from each team to share the information on their card and the answer to their question. After each team finishes their report, your job is to clarify or provide additional information related to that activity card. You can share the information as appropriate, following each team's report, or you can add anything that wasn't covered after all teams have finished. There's a key points box for this activity in the trainer's guide that includes all the information that should be covered before the end of the activity. Refer to these points, but again, try not to read the content word for word. As you go over the key points, remember to maintain eye contact with the participants. We'll take a few moments now to present the key points for each activity card. Activity Card 1 explains total cholesterol, which is a rough measure of all the cholesterol in the blood. Total cholesterol includes LDL cholesterol, HDL cholesterol, and others. Cholesterol is a yellow, waxy substance found in the blood and in all the body's cells. People need cholesterol to live, and it's used in many of the body's normal functions. However, having too much cholesterol may increase the risk for heart disease and stroke. Our bodies make some cholesterol, and additional cholesterol comes from animal products like meats, poultry, fish, eggs, butter, cheese, and whole milk. fruits, cereals, and vegetables don't have cholesterol. Cholesterol builds up slowly in the walls of the blood vessels, and this buildup is called plaque. Plaque can clog the arteries and block or slow down the flow of blood. When that happens, the heart has to work harder. Plaque can tear or burst, and a blood clot can form, stopping the flow of blood. Clogged arteries greatly increase the likelihood of heart disease, stroke, and death. If it hasn't already been stated, share with the participants that normally there are no signs or symptoms that indicate high cholesterol levels. That's why it's necessary to have a blood test to help the healthcare provider determine what a person's cholesterol level is. High cholesterol is one of many risk factors for heart disease and stroke. Activity Card 2 explains LDL cholesterol. LDL stands for low-density lipoprotein, and it's known as bad cholesterol. Too much LDL can build up in blood vessels and clog the arteries, possibly leading to heart attack or stroke. If your LDL is high, your risk for heart disease or stroke is increased. If you lower your LDL, the risk can be reduced. Activity Card 3 explains HDL cholesterol. HDL stands for high-density lipoprotein, and it's known as good cholesterol. HDL takes the LDL, the bad cholesterol, out of your blood. High HDL lowers the risk for heart attack and stroke. Having low HDL levels raises the risk for heart disease and stroke. Activity Card 4 explains triglycerides, sometimes shortened to TG. Triglycerides are another type of fat found in the blood, and a high level can raise the risk for developing heart disease. Conclude the activity by thanking everyone for their participation. The first group discussion is on controlling high cholesterol. You can begin the discussion by asking participants what causes high cholesterol levels and what other health problems can be caused by high cholesterol levels. Write their responses on the flip chart. You can use the information in the key points box in the trainer's guide to encourage group discussion. As before, avoid reading the key points word for word and try to maintain eye contact when you share this information with the participants. The key points include a section on the causes of high cholesterol. Many factors can cause high cholesterol, and some of them, such as heredity and age, can't be changed. If our parents have high cholesterol, we're likely to have it too. And as we get older, LDL levels tend to rise, especially after we turn 55. However, other factors can be changed or managed to lower the risk for developing high cholesterol. These factors include diet, weight, exercise, stress, and smoking. Another key point covers the things you can do to control high cholesterol. Maintain a healthy weight and follow a healthy eating plan that includes eating fewer animal products with saturated fats, such as red meat and dairy products like milk, butter, and cheese, and eat more fish. Eat less cholesterol by eating chicken without skin and eating fewer eggs. Include at least 6 to 8 servings a day of foods like fruits, grains, and vegetables. Eating foods high in fiber can reduce cholesterol. Check food labels to see how much fat and cholesterol are in each serving. Other ways to control high cholesterol include exercising at least 30 minutes a day, not smoking, taking any medicines as prescribed, lowering stress, and seeing your healthcare provider on a regular schedule. The key points also include other problems that can be caused by high cholesterol. When cholesterol is high, it can build up in the blood vessels, and a blocked blood vessel going to the heart can cause a heart attack. A blocked blood vessel going to the brain can cause a stroke. Conclude the discussion by reminding the participants that there are many ways for controlling high cholesterol. Item D is another group discussion, and its purpose is to provide participants with information about the recommended cholesterol levels and the medications available to help control cholesterol. You'll need one copy of the Cholesterol Health Card handout you printed for each participant. Begin the discussion by covering the information provided in the key points box. Try to avoid reading the content word for word and maintain eye contact with the participants. The first topic in the key points box explains recommended cholesterol goals. It's important to ask the healthcare provider how often cholesterol should be checked. For some people, it may be every 5 years. For others, their healthcare provider may check their cholesterol every year, or more often. If the blood test shows a high cholesterol level, the healthcare provider will discuss the numbers. The optimal number for LDL is below 100 mg per deciliter. The optimal number for HDL is at least 40 mg per deciliter, and the optimal number for total cholesterol is less than 200 mg per deciliter. A cholesterol level of 200 to 239 mg per deciliter is borderline, and a level of 240 mg per deciliter and over is high. Share with the participants that they should talk to their healthcare provider about their risk for heart disease. The risk will determine what their personal target cholesterol goal will be. People who have had a heart attack need lower LDL levels below 100 mg per deciliter. People with diabetes are also considered at high risk and need to keep their LDL levels even lower than 100 mg per deciliter. People with additional cardiovascular risk factors may be asked to lower their LDL levels to below 70 mg per deciliter. The key points explain which medications are commonly used to control cholesterol levels. Sometimes diet and exercise are not enough to reach the target goal, and the healthcare provider may suggest taking medication. People taking cholesterol medication should still continue their meal and exercise plans. Share with participants that, as with all medicines, they should inform their healthcare providers of any medication side effects, and they should not stop taking medications without talking to their healthcare provider. There are, however, certain conditions in which people should not be taking medications. Remind the participants to inform their healthcare providers about medications they're taking. There are different types of medications that may be prescribed for lowering cholesterol levels. Statins block an enzyme in the liver and prevent the body from making more cholesterol. Statins can lower LDL and triglycerides, and they also raise HDL. Statins may cause muscle pain or liver problems. Niacin is a B vitamin. Only take niacin if your healthcare provider tells you to. Niacin works to lower LDL and triglycerides, and it can also raise HDL. You should not take niacin if you have liver disease or gout. Some people find it hard to take niacin because it can cause face flushes. Fibric acids work to lower triglycerides. They can cause stomach problems and shouldn't be taken by people who have kidney or liver disease. Bile acid binders help rid the body of cholesterol. They can lower LDL and raise HDL, but don't have much effect on triglycerides. These medicines can cause upset stomach and constipation. Conclude the discussion by giving a cholesterol health card to each participant and encourage them to use the card to keep track of their cholesterol levels. Invite participants to ask questions and use the resources in your trainer's guide to provide answers. Unless you're running a 60-minute session, in which case you'll go directly to topic F, the next activity is item E in the trainer's guide, and it's titled The Problem Solvers. The purpose of the activity is to guide the participants through a brainstorming session and help them find solutions to real-life situations that may create barriers to maintaining their cholesterol levels within a normal range. You'll be using your markers, the flip chart, and one copy of each of the 3 scenario cards. We'll explain the flow of the activity first, and then talk about the information on each card. Start by explaining that the activity is meant to be fun, so they shouldn't be nervous or anxious. Divide the group into 3 teams and give each team a scenario card. Give the teams 5 minutes to read their scenario, analyze the situation, and discuss possible solutions. Let the teams know when there are about 2 minutes left so they can start finishing up. When the time is up, ask the teams to select one member who will report back to the group. Ask the selected team member from each team to explain their scenario to the whole group, and then to share the answers the team came up with to the question on their card. Write their answers on the flip chart. As each team finishes reporting to the group, your job is to make sure the key points from the trainer's guide have been included and clarify information as needed. Now that you've seen the general process for the activity, let's talk about the key points for each scenario card. In Scenario 1, Ms. Ryan just came from her visit with her healthcare provider and learned that her cholesterol is high. The healthcare provider recommended that she eat foods with less saturated fat, avoiding foods such as red meat and whole milk. Ms. Ryan is feeling sad because she likes to eat out and loves fried chicken, milkshakes, and steaks. The question for the team is, what suggestions would you offer Ms. Ryan to eat healthy and follow her healthcare provider's recommendations? If necessary, you can supplement the team's answers if any have been left out. Possible suggestions include eating fish, beans, lean meats, and poultry without the skin, cutting away any extra fat from meat or poultry, trying not to eat fried foods, choosing grilled, broiled, and baked options, cooking with vegetable oil, choosing corn tortillas over flour tortillas, and drinking non-fat or low-fat milk. In Scenario 2, Mr. and Mrs. Garcia are worried about their teenage daughter's health. She's gaining weight and doesn't exercise. There's a family history of diabetes and high cholesterol. Her daughter's healthcare provider informed the parents that their daughter has high cholesterol. To help her lower her risk for heart disease and diabetes, her healthcare provider told her to eat healthy, exercise on a regular schedule, and monitor her calorie intake. The questions for the team are, if you were the parents, what would you do to help your daughter? And if you were the daughter, How would you start exercising? If you need to supplement the team's answers, some suggestions for the parents include having healthier food choices, such as fruits and vegetables, at home, and encouraging the daughter to exercise by walking or dancing, and to make wiser food choices when not at home. Suggestions for the daughter are to start adding exercise, such as walking to the store, gradually into her daily routines, and to invite a friend to join her for exercise. In Scenario 3, Ms. Johnson is a 65-year-old woman who is diagnosed with high cholesterol levels. Her healthcare provider advised her to add exercise into her week and begin walking. Ms. Johnson feels that it is not safe for her to walk alone in her neighborhood. The question for the team is, what other exercise options would you suggest for her? Some possible suggestions are to dance to music, do chair exercises while sitting down, and find a low-intensity exercise video to work out with. Conclude the activity by thanking everyone for their participation. This topic addresses the importance of having an action plan. Distribute an action plan to each participant, then ask each person to review the items on the plan and select one or more items that they'll try to change or improve. The choices on the action plan include get your numbers, take your medicines as told by your healthcare provider, eat healthy foods, lose extra weight, move your body, always check with your healthcare provider before starting any new exercise program, and no tobacco. The key points about the action plan in the Trainer's Guide recommend that you emphasize the importance of an action plan and how it relates to improving and maintaining a healthy life. Share with participants that lifestyle changes are made one step at a time. Therefore, they should be ready, willing, and able to make changes that will improve their chances for a better and healthier life. Explain that there are 4 questions you'd like them to ask themselves based on what they selected on their action plan. They are, what behavior would I like to change? Is it a behavior that I can do? What must I do to achieve this change? And when will I make this change? Ask participants to select their confidence level for the behavior that they've chosen to change. Ask them to select a number on a scale from 1 to 10, with 10 being the highest, indicating how confident they feel about completing their action plan. If a participant's confidence level is less than 7, ask him or her to consider an easier plan. Conclude the session by distributing and explaining the High Cholesterol What You Need to Know handout. Invite the group to ask questions about the handout. Remember to thank the participants for their attendance and participation. Finally, invite them to return to the next session and encourage them to bring a family member or friend. Thank you for your contribution in sharing this important information, and thank you for participating in this training.